Welcome. My name is Efe Chantal Ghani. I'm a fourth year urology resident, and I'm sorry that you kind of got the tail end of our talk for the first group. But I'm going to have my co-hosts introduce themselves, and we'll get started from the top of the presentation. Do you guys want to introduce yourself?
Sure. I'm Jamie Temko. I'm one of the OBGYN interns here at UCLA.
And hi, I'm Katie Chung. I'm another one of the OBGYN interns.
Hi guys, my name is Dr. Agumbiade. I work in attending at some of the UCLA hospitals.
Okay, lovely. So this session, as you probably have guessed, since most of you have been on for, I think, what, 15 minutes now, it's cracking the code. So we're basically giving you tips and tricks that we have learned along the way as we navigated rotations, and we hope that that would help you transition into wards if you haven't already. And the reason why we think it's important is there's quite a big part of the curriculum that is unspoken, things that people expect of you that they don't tell you. And unfortunately, because of the subjective nature of how you're evaluated, can often impact the way you're graded. And so we want to help you set you up for success. So the first thing that we want to make sure we mention to you is this idea of being able to work in a team. And the team does not consist of just physicians. So you've got nurse practitioners, nurses, physician assistants, you've got the techs, the people who work at the front desk. And these people typically have been working together much longer than you stepped into this space, and so they know each other. So you want to be very mindful of respecting their roles and seeing them as people. And I think one of the easiest way to do that is to refer to people by name if you can. I personally am terrible with names. I always forget. So I've been doing this since I was a medical student. I still do it now. I carry index cards in my pocket with all the names of every staff member that I work with until I remember it. And I still keep it in my pocket just in case. So this is a way that you can connect with someone on a personal level, and that this means everyone. And then one of the things I want to remind you of is to just don't forget to continue to do acts of kindness, even if they're not observed. It's very easy to do them when people are watching and then not to do them otherwise. But again, if you have a secretary who's been working with your attending for 30 years, your attending's going to hear about it. And it's not just because someone's going to hear about it, but you want to be able to work in a pleasant environment. And this is one of the ways that you can actively contribute to that sort of environment or culture. So other simple acts, greeting people and waiting to hear for a response. I think normally most people do that, but the pressure of third and fourth year can make it such that you feel like you don't have time. We all have time. We all have 2 seconds to say hello. So please try and do that. And like I said, referring to people by name and saying thank you. If you're going to step into a new space, they don't know you, and now you have a request that requires them to stop what they're doing to help you, the least we can do is say thank you. So please be mindful of that. And again, I can't overemphasize the idea that all members of the team have value, and being able to consistently communicate with the nurses, with the case manager, let them know what's going on. I have seen students, unfortunately, who say things like, we're taking care, like that doesn't concern you, or that's not for you to know. So if a nurse inquires about a plan, it probably is because the patient is asking the nurse and they interface with them the most. So just be mindful of that as you're having conversations with these individuals. I'm going to take the next slide.
So now we're going to talk about pre-rounding, which is basically for inpatient specialties when you go and see the patient that you're taking care of before the whole team goes to see them. And so I think, you're now a third year, so it's exciting. You get to take ownership of patients and finally care for people and not just study all the time. So really take that to heart and consider these patients to be your own. Even if a resident is seeing the patients with you, do what you can to get to know that patient, know their history, know how they're doing, and then specifically in terms of pre-rounding, how they did overnight before, since your team saw them the prior evening to when they're seeing them in the morning. And I think a really important component of that is talking to the nurse who is taking care of that patient all through the night. So really recognizing, again, that multidisciplinary nature of the work that we do. So you can either call them, or I think it's really helpful to just take that minute to go see that person in person and put a face to the name, and get a sense of what's been going on overnight. You can also read in the notes and in the chart. I think oftentimes we read physician notes or notes from consulting services, but really taking the minute to find where the nurse is giving their report for how the patient did overnight will give you some really important info about what your team actually cares about on rounds that day. Did they get sick? Was their pain uncontrolled? Are they peeing on their own? Things like that you can get from talking to the nurse or reading that person's notes. And then, of course, seeing the patient is so important. There's plenty of information that can be found from the chart, but I think taking that time to go see that person will not only tell you more about how they're doing overnight, but it's also really important in getting that, provider-patient relationship. And it's one of the things that, at least for me, got me through third year clerkships when it's really hard. Take the time to go see your patient and get a little bit more rejuvenation that you're kind of finally doing what we've worked so hard to do. So talk to the patient, see the patient, really find out what their concerns are and how they're doing, and be as thorough as you can. We'll talk a little bit more about rounding and kind of what expectations are, but taking the time to take down notes, documenting important critical information from your exam or from talking to the patient will be really helpful for when you then prepare to present. And I think just something to always keep in mind in everything that you do in the hospital is just to be really honest. We're all still learning, even as an intern, and I'm sure everyone will speak to the fact that in medicine, we're learning forever. So we don't expect you to know everything, and we expect that some things might fall through the cracks. So if you forgot to ask a patient about something, or you didn't check something on a physical exam, don't make it up. Don't say they didn't know or someone didn't know. Just say, oh, I didn't ask that. We can follow up on that in rounds. And I think the team will appreciate that honesty. And then finally, I think once you've started to really get a sense of kind of what your role is and how you can effectively pre-round on your patients before the whole team goes to see them, then you can kind of start asking and helping out with other ways that we can prepare for rounds. So sometimes the intern will print out a list of all the patients on the service, and sometimes there's some documentation and annotation that goes along with that, or copies that have to be made. So once you feel like you've taken care of your role pre-rounding on your patient, then you can potentially ask the intern if you can help them with that preparation as well.
Lovely. Any questions so far? Anyone wants to chime in? All right, so rounding. So now you've pre-rounded, you've checked in on your patient, the team has come together, and now it's time to go see our patient on the service. So just make sure that you're ready. So allocate enough time for you to be adequately prepared, and make sure you're on time. And we recognize that life happens, so there are going to be times where you can't get there on time. Just notify the team about what's going on and what your expected time of arrival is. And you can do that by sending an email. I typically say to have 2 points of contact because not everyone's checking their email at that time of morning. Or if you have their numbers, you can text. I usually would do it to the person who's most superior, so the person leading the team, so that would be the chief resident. And then also would recommend doing it with sending a message to the intern because they are the closest person to you in the service. One of the things I recommend in terms of preparing for rounds is the day before, ask the residents, typically the intern or PGY2, what kinds of supplies you need during rounds. So for a service like urology, being able to have things like gauze or having 10cc syringes or Foley plugs, it tells us that you are anticipating what the needs of the team would be. And if you ask the evening prior, the afternoon prior, usually during downtime, it's a time that people have, the luxury to show you where it is. In the morning, things are a bit more tight in terms of scheduling and timing, so it might not be appropriate to ask then. So everyone's going to be given a list in the morning. You have a list of all the patients, what's going on with them. And as you round, people are going to be taking notes. You can take notes too. So you can take notes on what's going on with the patients, but also what the anticipated plans are for the patient. Because that way you're able to volunteer yourself for tasks to do. And we'll talk about that in a few slides. So make sure you take notes as everyone is. When you get to the rooms to round, one of my pet peeves is we all walk in, we rush into the room, we've spoken about the patient on the outside, we rush in, and everyone forgets to turn on the light. And usually the light switch is by the door, so what ends up happening is the whole team then backtracks and then someone stumbles and finds it. So you can be the person who just makes it your job to find it and turn it on, but most importantly, to notify the patient first. So if you're in a rotation such as mine, where you're rounding at 6 a.m., no one appreciates the lights going on at 6. So just a quick note of caution to the patient saying, about to turn on the light. I used to ask, is it okay if you turn on the light? But I was told by an attending not to ask that question, because if they said no, then you kind of put yourself in a pickle because you need the light to do your exam. So just give them a heads up that you're about to do it. When you get into the room, typically you're going to do a physical exam. And as a medical student, just assume that your role is to do the exam with the person leading the encounter, because the more exams you do, the more you're able to recognize normal in order to recognize abnormal, right? So if you're going to be the person doing the exam, you want to be ready to go. So you walk into the room, you've asked about you mentioned you're going to turn on the light, you switch on the light switch. First thing I would recommend doing is get a pair of gloves and put them on. Usually that's when the person leading the encounter is chit-chatting with the patient, asking them how they're doing. So you have time to put on the gloves, and you want to stand on the other side, so opposite the person leading the encounter, not on the same side. Because if you stand on the same side, you're actually in the way. You're not very efficient with helping them do the physical exam. If you stand on the other side, now you're in a position where you can protect the patient's modesty. So for instance, if we're doing an abdominal exam, there's no reason to see the groin area, so you can help prevent the sheet from being slid all the way down to the patient's knees, for instance. And then you can also do the exam with the person leading the encounter, so you can start to build your memory bank. When you're done with the exam, you also want to be the person who is like the advocate for the patient's modesty. So you cover them up afterwards. And then as you leave the room, just take a quick second to ask, do you want the lights on? They may want it off. And if they just had surgery the day before, they may be in too much pain to walk to the light switch to turn it off. They may want their tray or the table brought closer to them. They may want to have the, they have these little remotes that helps them call the nurse. They may want to have that close to them. So just take a second to ask if there's anything that you can do before you walk out the room. I typically find that that's appreciated on the part of the patient. Anything that anyone wants to chime in here? All right, you're on.
Okay, so now we're at the point where we're talking about presenting on round. So I think you've done your pre-rounding, you've seen your patient. Now it's time to kind of communicate to the team what you've learned and what happened for that patient overnight. Typically, we'll try to have medical students present, especially on patients if they were in their operating room when they had their case, or if they'd seen them the day before, helped admit them, then typically that student will kind of take ownership. But always checking in with the team to make sure that when you're preparing the right patient, you're preparing on a day where we'll be able to have you present, just confirming that it's an appropriate day to present, and understanding that sometimes, unfortunately, if the workflow is just a little hectic or the timing's a little bit more crunched, unfortunately, some days you might not be able to, but at least that way you're not putting in too much work and not having an opportunity to show it off. I've definitely been in the position where I've stayed up late to present or prepare a presentation, and then it just doesn't happen, and it's always a bummer. So try to check in to kind of save your sleep time and study time. And then I think just confirming with the team kind of how they like to have their presentations and what sort of template they follow. Ideally, that can be done the day before you present, so that it's not right early in the morning, but that's something that you can kind of check in with. And the other thing is you can speak to other students that have done the rotation prior to you to really get a sense of kind of what's expected of students and how they like to have their presentations go. And then any patient that you've been seeing, I would just be prepared to present, and again, kind of doing that pre-work and pre-rounding, and then understanding kind of how the information should be communicated. And being as systematic as possible. Again, taking notes, making sure that you're kind of following the same order every day to make sure that things aren't slipping, and being super comprehensive. You'll definitely see, especially your senior residents, give their assessments kind of throughout, and kind of skim over some things, like saying that vitals were within normal limits, or their urine output was adequate, or whatever that may be. but especially as you're learning, and again, even in my role as an intern, I'm still, really trying to demonstrate that I know what normal is. I know what adequate is. So giving ranges and giving that hard data and then providing your assessment. So for example, saying something like heart rate was this to this within normal limits or something like that. And then as you get kind of more comfortable on the rotation, perhaps the attending might tell you, oh, you can shorten that, or the resident can tell you that you can shorten it, but at least you've shown that you know what that is and you're putting in the work. And then I think as much as you can, and we'll touch on feedback more later, try to get feedback as early after as possible, sometimes after rounds, but if the workflow of the team doesn't quite permit that, trying to check in later in the day and try to see if there's anything you can improve on, any adjustments that they would suggest, to make sure that kind of you're applying that knowledge and applying that progress each day, and not feeling like you've gone through a whole week feeling uncomfortable with your presentations and not knowing where you can kind of build and get better. I think another thing that's really useful, especially early on in your year, is you can ask your intern if they'd be willing to listen to your presentation before rounds. And again, trying to set that up beforehand is better, because I would hope that most people are more than willing to help sit with you and kind of listen to what you have to say before rounds. But if their timing for the morning didn't quite keep that in mind, then there might not be as much time to do that. And that's, a bummer for everyone involved. And so as much as you can kind of prepare that beforehand, the night before, that you want to really practice with them, I think you'll feel more comfortable and everyone will be nice and calm in terms of the timeline of the morning. And then finally, I think there's always opportunities to share that you've gone home and kind of thought about your patients and looked into some of the things that, we're managing while they're in the hospital. And so you can always make a really quick comment like, oh, I was reading about this last night and I read this. And I think, again, keeping in mind with the teams, we'll talk about how every student on a rotation can be successful. There should not be any competition. I think the more that you can be helping one another, the better. And that teamwork is noted and appreciated. So kind of checking in with your fellow med student, like, oh, I'm going to bring up this paper that I read about, or this topic that I read about on my rounds. And that way you guys can feel like you're kind of on the same page in terms of your presentations.
I actually wanted to chime in here to talk about everything Jamie mentioned is great pieces of advice. Within the ER, the presentations are a little bit different and the flows are very, very different. You may work with different attending, you may work with different senior residents. So in terms of a couple things, in terms of seeking feedback for people in presentations, I would either ask your attending or senior resident, depending on who you work with on that specific day. And with regards to the presentation, you are decently systematic about certain things as well, but you're also very focused with regards to the patient's problem. So you'll still do the HPI, past medical, surgical history as relevant, and social history. You'll do your physical exam, including the vital signs, and you can be more thorough as a medical student. We don't expect you to have like a succinct presentations as a senior resident who, for me as an attending, I'm usually like, what do you think it is? And now like, I agree, I don't agree. That's not where you are. We expect to be able to see your thinking process. And then with your differential, which I think is most important in your medical management, oftentimes we want you to talk about what you think is most likely going on given everything you've accumulated so far with regards to the medical history in your exam, and then give other differentials. We expect a couple differentials at your level. We don't expect you just to say exactly what you think it is. And then with your medical management, give your opinions about what you think you should do. Doesn't matter whether you're right or wrong. We just want to make sure you're thinking about what you should be doing. And with regards to us, since we reevaluate our patients multiple times during your shift, make sure you are doing that and updating the team about what you think is going on, what you think you should do. And I think those are good things about presenting within the ER.
Perfect. Thank you so much for sharing all of that. There was one thing I wanted to add to what Jamie had said with regards to practicing your presentations, that I personally, for almost every MS3 who's rotated with us when I'm on service, would have them call me the evening prior if it's a new patient. So say we had a big surgery on Tuesday, so they'll call me Monday evening and we'll go over they'll call me Tuesday evening. We'll go over the presentation so they can present on rounds on Wednesday. And I typically would do this when I was driving home. So that's an opportunity, like that's a window of time that people are able to do it. So it doesn't have to be in person, and that actually might get you more buy-in from the resident if you're willing to do it over the phone. That it opens up the opportunities for feedback prior to presenting on rounds. So keep that in mind.
I'm gonna steal that. That's awesome.
So now you've pre-rounded, you've rounded. What do you do for the rest of the day, and how can you continue to be a team player and someone who's contributing positively towards patient care? So I personally tell people not to ask, how can I help? What can I do to help? Because that question kind of puts the responsibility on your audience to figure out what you're comfortable with, what you're capable of, and what it is that you would be able to do to completion. So I think the better thing to do, and you're welcome to take this if you want, is when you make that list during rounds, you have a sense of what the team is anticipating they'll do for each patient. That usually gets cross-checked with an attending if they don't round with attending. So for instance, for urology, we don't actually round with attendings, we round on our own. The attending is called, and then we have finalized plans. So just keep your ear on the ground as to what the plans are for each patient. Now, then you can say, for Mr. Jones, I can call neurology, I can place that consult, I can call them. And if you have volunteered yourself for a task, then circle back and let them know that the task was completed, because you don't want your resident to have to now figure out whether it was done or not. And then the work it takes for them to figure it out would probably be about the same time as them doing it themselves. So you kind of negate the work that you've done. So you volunteer for a task, you communicate clearly what you're going to do and that you're capable of doing it, and then you circle back that it's been completed. If there are things that you want to do, but you're not quite comfortable, you've never taken out a JP drain, or you want to learn how to take out the JP drain so you could do it in the future, then communicate that as well. I would like to take Mr. Or Miss Nancy's JP drain out, but I've never taken one out before. May I go with you? So you go with them, you see one, and then you do one with them present, and then you can volunteer to take out the rest of the JP drains in the rotation. That's actually how I learned how to take out JP drains. I went with the intern, I watched him do it, he watched me do it, and then I took out every single JP drain for the rest of the 2 weeks, and it was really fun. But you also demonstrate that, one, you're proactive about your learning, and then they get to see your graduated growth, and that's something that comes up on evaluations too. So these are tips that I think would help with regards to navigating how to be a team player on the team. Wendy, there you are.
Sure. So I think in general, in terms of going in the operating room, it's something that I always try to really remind myself it's a huge privilege to be able to be a part of someone's surgery. And I think if you kind of keep that in mind and recognize that it's a very special and different place than anywhere else in the hospital, I think that you'll really succeed in the operating room. And so I think part of understanding the privilege that it is to be a part of someone's surgery is meeting them beforehand and knowing about them beforehand. So I have definitely been, especially as the medical student, the person that spends time with the patient in the preoperative area before they go back to the operating room, and by meeting them before they're moving to the operating room or before they're undergoing anesthesia, you have an opportunity to kind of talk to them and provide some reassurance. And then that reassurance can be, you're the friendly face in the operating room as they're getting ready for their case or immediately after. So taking that time to make sure that you have seen your patient and spoken to them face to face before you're going back to their case, I think is really, really important. And then I also think sometimes the role of the medical student is to kind of hang out there, and then you can let the team know when the patient is going to the operating room, and that allows your team to kind of take care of some of the to-dos from the morning rounds, and again offers you that opportunity to really get to know your patient before the case. In addition to kind of interpersonally knowing them, you want to be really well versed on their medical history, their surgical history, why they're going to the operating room, and what the team plans to do for them that day. And that can be really, really important. Oftentimes attendings will kind of view that as criteria to be allowed into the operating room, is really having read about and known about this patient before going in. And then I think other things that you can do to prep is really, again, getting to know the team. This is a super multidisciplinary area in the hospital, and that's one of my favorite things about being in the operating room. I feel like I learn so much from everyone, and honestly, as a med student, oftentimes I'm learning the most from the scrub tech because they're helping me learn the instruments and know what goes where and when I can be helpful and when I can step back. So putting in the face time, being respectful, learning names, and introducing yourself goes a really, really long way. And then recognizing that there's a lot of kind of logistical things that they have to keep in mind. So when you go in, if you can write down your name on the board so that when they have to document who's in the room, they don't have to kind of chase after you and look at your badge to figure out what your name is. Really, again, taking the time to let them know who you are and asking questions about what's appropriate and safe for you to do in the operating room, I think is super important. We obviously don't want to touch anything that's sterile. We don't want to touch anything on the scrub text tray. So taking the time to demonstrate that you're thinking about that and confirming, like, can I touch this? Do I need this? It's better to ask than to be breaking sterile field and having lots of other steps that have to go into kind of fixing that mistake. So always keep that in mind. Oh, another caveat is also just be honest. If something does happen, you accidentally touch. I remember as a third year student, I was horrible about adjusting my goggles. So I would always have to rescrub my gloves. But luckily I was pretty far back, so it didn't interfere too much. But be honest, if you've broken sterile field, chances are someone has noticed it. So just notify people, and then the appropriate safe mechanisms can kind of be put into place. The scrub techs will generally pull your attending's gown and gloves, but if you're kind of an additional person in the operating room, it's important for you to pull your own gown and your own gloves before the case. And you can also ask your resident, your intern, or whoever else is going back there what their preferred glove sizes are, so that they can be kind of prepared when they just walk in to do the case. The other things to think about, we spoke about kind of knowing the indications for the case, but doing a kind of brief run through of the anatomy is really important. You shouldn't be expected to know step-by-step what's going to happen in the case. That's above your level as an MS3 or an MS4, but understanding in general where things are and what's the goal is goes a long way. And then I think even kind of before and after the case, one of the things that you can be super helpful with is helping position the patient. And again, especially if that patient knows your face, knows who you are, is reassured by your presence, you can be kind of part of helping to safely position the patient. Again, really keeping in mind their modesty. It's a very vulnerable position to be in the operating room. So if you can make sure that they're covered when they don't need to be uncovered, or that they're not just being kind of left exposed on the operating room table, really taking that time to hold their hands, check in with them, learn about patient positioning from the nurses and the scrub techs and all that jazz. I think that is super, super helpful. And then finally, I think this is just kind of a general tip overall, but really understanding when is a good time to ask questions and what is an appropriate question. I kind of like to think of things as like there's a Googleable question. I don't know if that's really a word, but there's something that you can certainly look up instead of asking the team. There's something to ask your intern if it's kind of more of a logistical question about how to get into a patient's chart or how to find this information. And then there's questions that might be more appropriate for a chief or an attending. So trying to keep in mind kind of before you ask the question, who should I ask this to, and is this appropriate for me to be asking right now, is really important. In the operating room, there's certainly times where it's inappropriate to ask a question if things are kind of acutely happening or it requires a lot of focus and attention. But in the times where it seems like there's a little bit more downtime, I really think it's useful to kind of think about the case beforehand and kind of try to prepare 1 to 2 questions that you might be able to ask about either kind of the steps leading up to this choice in management, like what alternatives to management there are, or other questions about like the logistics of the case that demonstrates that you have thought about it and you're really thinking critically about kind of what's going on.
Right, so I completely agree with everything that's been shared. Just a quick point about pulling gloves. The scrub techs are very territorial over their tables. Sometimes they expect that you pull your gloves because you're a new person in the room. They don't know who you are. They don't know what your gloves are. And there are times where you pull the gloves and then they they may not want you to put your gloves on the table because they don't know you, and they're like, well, you might break the sterility of their table. So I always just ask when I'm on a new rotation, I just ask them if it's okay to pull my gloves. And sometimes they say no. They want to pull, they just want you to tell them your size. But sometimes they say, of course, who's going to pull it for you? So just be mindful. So ask, you wouldn't lose anything there. And I couldn't agree more with everything else that's been shared. Anyone else have any thoughts about the operating room specifically before we move along? All right. So navigating clinic. So this is pretty straightforward stuff. You have a patient that you're going to see in clinic. Clinics can get pretty busy. So for urology, for instance, we see somewhere between 70 and 90 patients in our clinic days, usually split between 3 people, 2 residents and an attending. So it's very, very fast paced. So you want to try and get as much information as possible before you see the patient so that you're moving their care forward. And you also have to remember that if you let anything slip, that patient may not see a physician for another, 3 to 12 months. So you want to be thorough and efficient. I personally look at the past 3 urology notes to get a sense of what that patient's trajectory has been. Maybe the person who last wrote the note may not have been as thorough as you would have wanted, so you have a sense of if anything's been missed. Then I also always look at the primary care physician's notes, just get a bird's eye view of the patient's care. And if there are any specialty notes, so say the patient saw radiology, interventional radiology, or I don't know, if they saw the cardiologist, you want to get a sense of why that is, to get to know if there's anything that would be related to the care that you're providing. And then now think about how you typically gather information for either forming the list in the morning or how you systematically go through writing a note, and keep to that same structure. If you tend to look at vitals first, and then you look at labs, and you look at imaging, then do that. Or if you tend to be the person who looks at all their prior history first, so past medical history, medications, past surgical history, then you look through vitals and labs and imaging, do that. The whole point is you want to pick a system, and you want to keep doing it so it becomes second nature, so you don't miss anything. And then when you present in clinic, again, this is something that's a good idea to check in with maybe a student who's done the rotation before, or one of the residents, to get a sense of what would be the most efficient way to communicate this information without slowing things down to inappropriately, but still being able to learn from those interactions you're having, because your number one role in your MS3 year is to learn, and then to provide patient care. So you want to make sure you're not losing that in an effort to be the resident. You're not there yet, and you will certainly get there. Then you want to verify what the protocol is with regards to physical exams, particularly for rotations like OB-GYN and urology. Sometimes they want you to do the exam, and then they will have you go back with them and do the exam. Sometimes you're going to be the only person doing the exam, or they might want to save the exam for when they go in with you. They may not want the patient to have to go through a digital exam twice. So just find out from the resident or prior students what the protocol is, so that you don't inadvertently cause any mishaps. Questions there? All right. Did you want to say anything about the EM flow? Because I think you did it here as well.
I just want to add one thing to the clinic. Sorry, my computer just, now I'm on my phone. The other thing that you can do, especially when you're not going to be doing some of the more sensitive exams on your own, you can still prepare the patient. So after you've listened to heart and lungs, which I think even if it's not necessarily indicated, it's good for you to learn what's normal, what's not. So kind of listen as much as you can. Or you've done an abdominal exam, whatever is appropriate that you've discussed with the team. At least for OB-GYN, if we have to have the patient undressed from the waist down, you can still, as the student, when you're leaving, prepare them that this might be happening, and kind of why we might be doing an internal exam, and then have them undressed from the waist down, so that when the resident is ready to go see the patient with you, the patient is ready and things kind of continue to flow.
And with regards to the flow in the ED, it's very different from the clinic or the operating room. I think what's most important is for you, you're aware of everything that's going on with your patient. You're also there to help out with the resident and or the attendings when anything else more critical comes in, whether it be chest compressions or helping with the laceration repair. There are ample ways for you to get involved. Just be aware of your patient, everything that's going on, and also be up for helping out with anything else that might be going on, since the ERs are constantly changing, constantly evolving place.
All right. And so we're going to end with getting or eliciting feedback and making sure that you really have a strong sense of what the expectations are of the people who are evaluating you. You provide enough room for yourself so that you're able to adequately make changes in order to meet the expectations that they have of you. So you don't want to be surprised at the end. One of my attendings tells a story about his co-resident who thought he was doing an amazing job and was trying to get into a fellowship within our institution, and unfortunately he didn't make it in, and he thought that he assumed that he was going to get in. You don't want to be that person who makes assumptions. So at the very beginning of the rotation, I typically do it in writing, where I ask the chief resident and then maybe the attending, because you usually assign, there's a point person that you're assigned to typically. I ask them if there are any expectations of the rotation, so I have a clear set of a clear idea of what they want me to do. And then I typically would, like 1/3 of the way through, and usually most people will say halfway through, but I like to leave enough time in order to make the adequate changes if they're identified. Now, as you can expect, feedback requires there to be some degree of criticism, and the goal is for it to be constructive. So it also requires that you're open to accepting whatever that information is. So just be mindful of that, because there have been instances where people get incredibly defensive, and so they don't allow themselves the opportunity to grow from the information that's offered. So, just be mindful of that. Now, you also want to have some information to engage the person who's giving you feedback. And some of the questions that typically are asked of you are, what do you think you've done well in this rotation? What do you think you've learned? How would you have done things differently? So knowing that those are questions that people use as conversation starters, and it's usually a probe to get a sense of what your degree of introspection is. Have some answers prepared so you're not having to fumble and make up things along the way. There might be deficiencies that you've noticed about yourself on the rotation that people have not noticed. So this is an ideal moment for you to take control of your narrative. So if there is a deficiency that you want to communicate, think about how you can communicate it such that it's not like a total, it doesn't come across as a total failure on your part, but you show some introspection. I recognize I did X, so I could have done X differently, and this is how I'm ensuring that I grow from that experience. So don't just dump a failure in their laps and not have a solution, because you want to show that I've thought it through and I've actually been proactive about how I'm going to get past this hurdle. So I think that's particularly important. And then give them feedback about the rotation. There are other students who are going to come after you, and they would benefit from you saying things like, it would have been nice if the students had a chance to present. You don't want to go in a rotation for 4 weeks and never get to say a word. That's something that the folks running the rotation should be aware of, because you are paying money to get your education. So you should get your money's worth. And if there's anyone else who has any other feedback, tips and tricks that they would like to share, please feel free to do so. We're happy to stick around for a few more minutes to answer questions. And then we also will put our email addresses out. If you have any questions along the way, we're more than happy to answer them.
Thank you so much for sharing. Definitely learned a lot. Thank you.
You're welcome. So I think that I just touched base with the overall organizers of the event. So it doesn't seem like we're going to be going back to a final session. So this would be it. So we're really excited for all of you stepping into your MS3, MS4 years, whatever it is for you at this point. Medicine is an awesome career path. And all specialties have their strengths and weaknesses, but hopefully you find the right fit, the right path for you. And we're more than happy to be advocates for you along the way if you need us to be. All right, well, hope everyone takes care and have a good rest of your weekend.